And we're off. Alani, a drink for everyone / Taylor.
Especially Taylor.
Especially Taylor. Are they sponsoring you, Taylor?
I wish, dude.
Yeah,
if they could send me some PR packages, I would love it.
It'll be, hello, Alani.
Yeah.
We have so many followers.
So many, all 50 of them.
We did increase by like almost 20%, 25% actually.
It makes me think of what you said yesterday when you're like, I think it was you or was it Chris? We were talking about how somebody forgot to do something for one of our patients, but the person said, but it was just for one patient. And the response was, we've seen two. So that's 50%. And I was like dying laughing. Oh my gosh.
Yes, that's good. Mm-hmm. Well, hello and welcome to Slice of Piefer. I'm Dr. Piefer. I'm here with my no longer emotional support PA.
No longer?
No.
When did I get demoted?
We have to change names.
But that doesn't mean I'm not still your emotional support PA. You literally said it whenever I went in with you to see that last patient.
I did just tell that last patient you were my emotional support PA.
Yeah. So when did I get demoted?
We gotta come. I thought we were gonna have a new name each time.
We could, but it kind of makes me sad that you're saying no longer. So now I kind of want to claim it again.
All right, fine. So she's back. She's back. Emotional support PA. Thanks, Tay.
You're welcome.
Glad that you could be here.
Yes.
What I think we should open with the stool fights.
They're getting out of hand.
The stool fights are getting out of hand, and we're not talking about...
I think we should have our own stools and not share stools anymore.
Right. And I think that those stools are... We're not talking about monkeys at the zoo, people. Mm-hmm. Just so you know.
I mean, I don't know anything about monkey stools and what fights they get into.
You know the monkeys throw their feces at people?
I'm talking about a chair. I'm not talking about feces.
I'm talking about a soft black stool. Mm-hmm. We have in each room. So gross. So gross. You're mixing in medical double entendres.
Well, we are this format, and we're both in medicine, so seems apropos.
Very true. Yes, basically, Taylor, I can just put it out there. I almost throw out my back and my knees every time I go into a room that she's been in before me because she puts the stool down about 6 inches off the floor.
Well, I am short. And so when I come in and I go to sit in it and my feet dangle like I'm a toddler, I have to put it down. It's even better when I sit down and I'm like feeling around to try to find the lever in front of the patient. And sometimes I try to do it real subtle, like I'm talking to him. I'm like, yeah, so tell me about what's going on with your knee.
Yeah. Yeah. I just basically almost fall on the floor each time. And
I'm really helping you get your quad strength up, though.
Yes,
you're having to come up and down.
It's like I'm having to go and catch for the Houston Astros every time I go in there.
Probably, that would be a good way to prepare for it.
Good, yeah. Building my quads, stressing my patellofemoral joints.
Yeah, I prefer to call it battle chairs. So I know if you were the last person in a room to see a patient over me because of how high that.
I like stool fights better. I mean, maybe everybody can vote. What's your vote?
I like battle
chairs.
There's
50 plus.
I don't like to say me and Dr. Piefer are in a stool fight in front of our patients. I say Dr. Piefer and I like to play battle chairs.
I say, did you see Taylor's? Did you see Taylor's stool?
It's so low to the ground.
So gross. So gross. Mm-hmm. So gross. But it's all good. It's all good.
Taylor's stool's out in the hallway.
I'm so tired of Taylor's stool.
Why do you keep leaving this here?
That is good.
Why don't you? And makes me think again, too, of like, why not put the stool down for me like a gentleman? Kind of like what you might do somewhere else in your home when you go use a place and you put the seat back down afterwards. So you could do that for me with this. You could think when you're getting up from your high seat, your high stool, you go, Taylor, maybe in here next. I'll just lower it for her.
I've never been accused of being tall, just to be clear.
You're tall relative to me.
True. Yeah, I'm like 25% taller.
Yeah, just towering over me.
Correct.
But I also have short legs relative to my torso, so that doesn't help the situation.
I don't know. There's not an orthopedic leg torso ratio that we're talking about?
No, it's just a known thing. Like when you look at people from proportions, like when I did gymnastics, that was always something I got commented on was I had a long torso relative to my legs, which meant I was really skilled at certain things and others were a bit more of a challenge for me.
People just told me that I had like hamburger hands.
You do have hamburger hands. That's accurate. Man hands.
I think they're pretty cool.
Your hands, other than your curved finger, yeah.
Yeah. Which way are we going? I don't know. Helps me in surgery.
Why are all
Work
his
around
incisions
corners.
slightly curved?
Work around corners. What? Straight line. It's perfect. Perfect incisions.
I had a
every time.
patient ask yesterday, "What are these lines right here?" And they were the purple hash marks. And I said, oh, no, they were lined up. But I said, we call those Aggie lines. It helps us make sure that we close the skin back in the way that we cut it. And she started laughing. She was like, I just thought maybe it was some kind of stitch or something like that, or if it was some kind of tattoo from my knee replacement. And I was like, no, it's just so Dr. Piefer sews you back together the right way.
Correct. It's just like guidance. It's having paint by numbers, stitch by numbers. It's all good.
Yeah.
All good. We had a busy week this week. It's been pretty good. We had four big joints yesterday. A revision shoulder. That was crazy. So super fun. But a challenge nonetheless. But all good. All good.
Good thing you
was
like
good.
challenges, I guess.
Yeah, for sure. Yeah. I can't do it. I can't do it.
You can't do the yes as well.
I do not. I don't have it. I do not have it. But
It's okay.
it's all good.
We like you anyway.
I appreciate that. I appreciate it. We're looking for sponsors. Alani, we were pitching them earlier. House of Pies. Who else would be good?
As a sponsor?
Yeah.
Well, I mean,
Limo Studio.
yeah, I've got my Columbia fleece here on.
Nice. Texas A&M University. We've got a couple videos with their stuff in there.
Yup, we sure do.
That'll be good. We are accepting
I'm
sponsors.
even wearing my Aggie
technically.
ring right now, I think.
Nice. Nice. I lost mine.
I was going to say, yours is missing, isn't it?
Mine's been MIA. I'm waiting for that day, when somebody posts on Facebook, we found this ring like in a dumpster or at a pawn shop or something. I don't know. I don't know where it is.
Do you remember how
moves.
you
It's
lost?
been a long time. Probably medical school.
Yeah, so I lost mine in between moves. From the move from here when I moved to South Dakota, I put it in the box it came in, and it didn't fit at that time. So that was thing number one. I had gained weight and my ring didn't fit. So it was just in the box, and I didn't find it for a year and a half.
That's pretty good.
But
well,
then
I
I
haven't
found it.
found mine for over a decade, so I don't know that it's going to show up anytime
You
soon.
know how we can guarantee you'll find it? Order you a new one.
We could order a new one.
If you
Yes.
ordered a new one, then I'm 100% certain you will find it.
You can get it. It's the price of gold.
Gosh, can you imagine the price difference of that ring?
Craziness.
If you order it today versus when you ordered it.
I don't know how much Aggie rings cost now. I bet you that they're expensive, though.
Yeah, I remember my cost when I ordered this one. So like
Does yours have a diamond or no?
yes, it is the medium sized diamond.
Yeah.
So not the biggest, not the smallest, the one in between. My friend Amanda convinced me to order that size because it doesn't completely cover the shield. That was
Nice.
her argument, but it
That's
was
a good argument.
it would for a lady's ring, right? It was in the 500s, but I bet it's a lot more now.
Did you watch the A&M game this weekend?
I did.
Did you? How did you survive?
Barely.
I thought that I was going
Barely.
to have to see you in the emergency room. I was having a panic attack.
Yeah.
I was like, how are we losing 30-3? This is crazy.
Yeah, it was nuts. But I mean that comeback. Holy cow.
I wish I could say that it was all orchestrated just to be like a Marcel Reed Heisman reel, but I think when you play that poorly in the first half, everybody's just like, "Oh my gosh, this is so bad." Really, if you're South Carolina, you just got to say what on earth happened. Like, how do you go from a 4-touchdown lead, 4-score lead to nothing? I was just like, that's crazy. Then it could have been even worse. We could have scored at the end, but instead we just threw the ball out to the side and let them recover it. But it was I did enjoy the second half. The other thing that was crazy about that game to me was there was not really a point as soon as we got into the second half that I didn't think that we had a chance to win. Had they scored on like an opening drive of the second half, I would have basically been like, okay, this is over. But we did great. I mean, and I say we as if I see we as if I play on the team and help coach.
I never think that there's not a chance we could win. I always think that there's just that magic that's in the air that we could still win. I mean, I've been at Kyle Field where like everyone's pretty much cleared out, and I'm like, but there's still a chance.
There's still a chance. I am not leaving.
Yep. I mean, I'm already here. Might as well
Might as
stay and ride it out to the end and hear the spirit of Aggieland.
There you go. There you go.
If nothing else, I'm there for the band.
That's right. That's right. We talked about did we talk last time we talked about about my talk? Did we talk about pressure and compartment syndrome and all that fun stuff? We talked about that last time. Okay, good.
Yeah.
So that's good. We already talked about that. Yeah.
Yeah. Well, you were wanting to talk about things we've learned from the operating room, though.
Yeah.
Right?
Fill me in. What's your favorite things? What have you learned from the OR?
Well, speaking of pressure, one of the ones was working, well under pressure. You definitely learned that from the operating room. And I thought of the phrase that we have in the med staff area, the no pressure, no diamonds.
Yes, that is a classic. That's
Yeah.
a classic story, not from the operating room.
Right.
Classic story while I was doing physicals on a young man who was probably about 6'4", 270, and he was wearing a shirt that said no pressure, no diamonds. I was like, hey, dude, that's a cool shirt. What does it mean? And he just growled at me, and then I turned around and Chris had disappeared.
So why that was popular around that time.
I have no idea.
So RG3 was trying to trademark it.
Sell diamonds.
Well, no, he was trying to trademark the phrase "no pressure, no diamonds." He filed for it in 2012, trying to get that as his So he was saying it in interviews and stuff.
Well, maybe that's why it was on that kid's shirt.
Correct. I suspect that's why it was on that kid's shirt. It's because there was merchandise and stuff being sold with it. RG3 didn't come up with that phrase.
I had a bunch of young kids.
That phrase was coined long before RG3, but I just remember it was a deal that he was trying to trademark it. And I remember thinking at the time, because I was in PA school, and that phrase, people were throwing it out there, and
Really?
yeah, absolutely. And because there was a lot of people who went to Baylor at my at PA school, and so they were saying it. I'm like, I'm pretty sure I've heard that before, and I don't think it was from RG3. And sure enough, I looked it up. I'm like, yeah, like a Scottish philosophizer.
Nice.
Now he's a philosophizer.
I like it.
Came up with it a long time ago, but that's definitely one that you learn from the operating room. I mean, you learn to perform under pressure. I mean, athletics and stuff
Stay
teaches
calm.
you that too, but there's something about, being able to walk away at the end of a game, even if you lose, and there's not somebody who's, maimed
Right.
in the process.
Yeah, I mean, I think you definitely learn it in athletics, but in the operating room, right, if you let the pressure, the consequences, right, the high stakes that come with that, if you let the pressure get to you, that's a big problem.
Yeah.
That's a big problem. Primarily just because it affects patient outcome. The entire room, once the leader and once the team starts decompensating, you've got to take a minute to just regroup, refocus, get back to where you need to be, get yourself reoriented and move forward.
Yeah. Well, I would say something else that I learned at least early on when I first started, going into operative cases when I was still in school and in training was, that you could do everything right. You could prepare well. The case could go really well. Everything could go as good as it could. And I remember because it was like one of my first cases I got to do was a cabbage on this lady. She was otherwise fairly healthy. I mean, she was in her late 60s, but it was one where I was heavily involved. It was like the first one that I really got to first assist
Needed a
on.
heart bypass.
Yeah, she got a triple bypass, and I got to close her entire leg up because we couldn't do endovascular. So I was really invested in this person. She was doing great in the hospital. She had a lot of family support, and then her post-operative follow-up appointment came up, and she no-showed, and she had passed away, and. I remember just taking that super hard, and I was sitting there just ruminating over what could we have done different? Did we make sure that we sent her home on blood thinners? Did we make sure that she was ambulating, that she was set up with cardiac rehab, that she was, and at the end of it, there was nothing that was missed in any of the steps.
Right.
We did everything well. She just didn't make it, and that was something that's a hard thing to accept, especially if you go into medicine. You tend to have a little bit of that savior complex. And
I agree.
That was definitely one that I learned early on, and it humbled me a lot.
Yep. I mean, 100%. That's just one of those moments when you say, man, we did everything that we could do correctly. Now, I think obviously looking back and reviewing those cases, seeing what you could have done better, what you ultimately did, I think all that's super, super, super important. But But yeah, if in those cases, sometimes it just happens.
We had early on in my orthopedics career, it's once I was like working, one that stands out is this guy came in and his chief complaint to see us in the outpatient clinic was knee pain. He had a knee replacement done by somebody, and it was they did a good job. His knee looked great. His incision was well healed. He was 1.5 years out from his surgery, no swelling, great range of motion, great strength, but he was still complaining of severe knee pain. And I just remember thinking, like, looking at this guy and trying to figure out what was going on. And he just kept complaining of, anterior knee pain. And he kept rubbing the front of his knee. But then I saw him kind of do the thing where he rubbed the front of his thigh. And I got that hunch that maybe it was something else. And so I got an x-ray of his hip, and it was his hip. He had AVN of his femur. So he had started like almost dragging his leg because it was hurting so bad. But his only complaint was knee pain.
Right. Yeah, it was.
And so again, that surgeon that did his knee replacement technically did a very great job doing his knee surgery. It just, that wasn't the problem,
Right.
So he did everything right. The patient still didn't do well. Why?
Right.
Because his problem was something different that was just atypical, right? Most people who need a hip replacement or have AVN complain of severe groin pain. They have severe, pain in their hip. They have limited motion in the hip. And he did, but he didn't know it. He didn't know that he didn't recognize or say anything about putting shoes and socks on being a problem until asked.
Right.
Right. So that was
all a little bit hidden in plain sight.
And again, like looking at him, he was upset with his surgeon, who did his knee replacement. I'm like, he did a technically very good job. You had knee osteoarthritis on x-rays, right? Like
You've been complaining of
knee
thigh and
pain.
knee pain.
Right. So he treated your knee pain. Unfortunately for you, your knee osteoarthritis wasn't causing your knee pain. And so that's all, that's one of those things that we always tell people when they're signing up for a big surgery like that is we're doing this all under the presumption that this is the sole or main cause of your problems.
Right.
Again, why I try to talk everybody into let me stab them with a steroid injection or something first, just so we can
get that therapeutic and diagnostic injection so that we can know not only make you feel better, but we can also help assure ourselves that this is what's causing the pain.
Right.
I agree.
Yeah. Yeah.
So what do you do if you get lost in the OR?
Are you asking me to quote you?
You don't have to quote me.
Well, it is the quote that I hear whenever you get lost in the ORs. Look at your hands.
Yep.
Yep. You look down and, well, for me, if myself personally, if I get lost or if I'm, the first thing I do is take a deep breath, like a really deep breath. The power of like breathing exercises to calm you and realize like right now I've just got to focus on that. And then the second thing I typically do will be orient myself in some way. Look at something that I can use as my guiding compass, which most of the time, like an arthroscopic surgery, it's going to be your hands, right? Especially because I can look at where I'm holding the camera and where I'm angled, and I know how many degrees the scope is bent, and I know which way I have it oriented so I can find myself and know where I'm at. Honestly, the days of getting like lost and something like that, it's been a long time since I felt lost. It has to be a pretty significant, like, abnormal thing like that. The polytrauma that we did some time ago, where we had to be in the like axilla of the shoulder, essentially trying to do that reattachment of that Hagel.
Yeah.
Like that was the last time I felt like this is a little bit disorienting because it's not a typical view you're seeing of the shoulder.
You're not used to where you are and where the instruments are coming from.
And you're slightly nervous about this pesky thing that lives underneath there.
Right. Well, I mean, I think that I agree with that. I think that key, I talked with somebody about it this past week, but the thing that was cool about it was that's like that reorientation is, so when you look at your hands, right, your hands are holding the cameras are going into the patient's shoulder or knee or whatever it is. But if you can reorient yourself, if you keep focusing and focusing and focusing on the screen, then you become more and more lost. And you can become more and more lost because your anatomic landmarks aren't there. So maybe you're pushed too far in. Maybe you're pointed in the wrong direction. Maybe there's a big flap of tissue you should be seeing in the biceps tendon, but you're not seeing that. But if you keep focusing and you keep pushing further and you keep becoming more and more hyper-focused up there, then you lose the fact that you're in all likelihood just pointed in the wrong direction. And that part is a really pretty good analogy for life as well, right? If you keep becoming more and more focused on the problem and you don't reorient yourself, take a deep breath, then you can get yourself so frustrated and into such a challenging position that you can't get back out of it. And so the only way to get back out is take a deep breath, step back, look at your hands, reorient yourself. Because now that once you kind of in your mind's eye can see, here's where my hands are, there's where the camera is, this is the way the camera is facing, this is the way the patient is positioned, right? They're on their back, they're on their side, they're in the beach chair position. Right. Well, now all of those things, like what should I be seeing? And then when you look at where the camera's facing, you say, well, actually, I should be seeing, I should be seeing the ACL, or I should be seeing the medial meniscus, and it's not there because there's a bucket handle meniscus tear there, or something along those lines.
Right.
So that's I thought that was a pretty good one, pretty good analogy for life.
Yeah. Well, and I mean, it's great advice for the operating room, especially even people who aren't having their hands in on the case, right? Whose hands aren't touching. Like I hear you tell the reps that all the time, new reps who are coming into the operating room. Like if, when you ask them, do you know what I'm looking at? And they can't answer, then you always give them that advice of, okay, look at the camera, look at my hands, see where I'm pointing that, know the basics of the instrument to know this is a 30-degree scope. So that means it's going to have that 30-degree bend. Where this is pointing, that means you can tell where the camera is pointing based on this dial. And then having them learn that trick, it helps them to always orient because they know if you're in the anterior portal and you're looking posteriorly and you see glenoid here, then that has to be posterior labrum. He's looking at, or whatever. So
Absolutely.
That's pretty helpful.
I think it's a good one for sure.
What's something that you've learned from the operating room?
We're going to flip it around.
You can't be all me.
I understand. Well, I think to me, I've really learned the value of a team, right? That part, I think that surgeons, as we keep advancing, as we keep moving through from college to medical school to residency, being an intern, a second year, a fourth year, a fifth year, a fellow, right? You can get this level of confidence that you can do it all on your own. And if you just take a minute to think about all of the different steps, all of the different things that have to happen, and all of the help that the people in the team are doing for you, if you had to do it all on your own, you couldn't do it, right? You can't get 5 trays of 200 instruments sterilized, cleaned, put where they need to be, all of the prepping, draping, all of the implants, everything together, making sure that the patient is obviously asleep and not feeling anything. And right, there's so many different things that are there, and it's very easy as a surgeon to kind of focus inward and look at yourself and focus on those things. Whereas the reality is, if you treat everybody in the room like they're a teammate, like we're all working towards a common goal with a common purpose, and we're trying to move forward to do what's best for this patient. I think I told those medical students, if we're trying to will the good of the patient, if we're trying to love this patient, then everybody together is doing that together, then that is a huge, huge bonus in terms of moving forward for your team. And that's why, for me, for reps that are in the room, like I want to hear what you have to think. I'd much rather that if you have a question or a concern or something, that you voice your question or concern, or if you say, hey, what about this, right? Or if for you, or the scrub tech or the scrub nurse or the circulating nurse, all of those different options, you can have a positive effect on the treatment of the patient by being a part of the case and being a part of the team and contributing. And so that part to me is that value. I mean, I think I've learned it throughout athletics and working with teams and working through medical school and other different things. But in the operating room, that advantage, you just never know when someone in the OR is going to say something that makes the case turn for the better. Right. Saves you an extra 15 minutes. When that scrub nurse who has been paying attention for the last 5 times you've done this, now all of a sudden takes a case that normally takes 60 minutes and makes it into a 40-minute case because they know every single step that you're going to do before you even have to ask. Right. And that's good for the patient, and it's good for the team.
Yeah. Or when something's going atypical in a case, things aren't going the way that you want, having somebody who's paying attention and going, have you thought about trying this instrument or using this? I mean, that's one of my favorite parts, is when I see somebody actively paying attention and they come up with an instrument or something like that we wouldn't have thought to typically use. But they've seen it done that way before. They think it could work. I mean, that's where things like the pituitary ronger, using that for like the back of the knee to get osteophytes off the back. That's not something I've seen most people whip out to do that, but it was a suggestion, once of, you could get back there and use this. And now something that was used as a pituitary rongeur was used in the brain, not
Right.
so much in a knee joint, but now we use it all the time.
Yeah, it's a small grasper that you pinch into the back of the knee and you pull.
It's got like a
osteoporosis
scissor-like
and loose people.
handle on it, but a really long neck and then a tiny mouth at the end. So you can see how it would go into a joint and then be able to get to the back to open its little teeth up to get that the pieces out. Whereas bigger instruments like the big hand rongeur, with your
Right.
big paws trying to get that into the back of the joint, that's not as easy.
Or a coker or any of those that have much longer moment arms that where you can't spread, you can't get that space in the back.
Yep.
And so that's very true.
Yep. That was one of the things I put on my list of things that I've learned was speak up. So you brought that. Like, there's been several times where I thought what I was seeing or wasn't important, and went on to regret it later when there was something that happened that maybe could have been prevented, or if I had spoken up. And so that was a big learning moment for me when I was in my training. Was I would rather sound stupid, right? I would rather sound like I'm saying something stupid, and have somebody tell me like, oh, no, don't worry about that. That's okay. Then not say anything and then wonder if that made the difference between a successful outcome and a subpar outcome.
100%. And what's the worst that can happen, right? It's like, hey, do you want to use this instrument?
Well, when you're in training, the worst thing that can happen is you get pimped or, demoralized by, the people who are trying to teach you, which to me is not the sign of a really great educator. So I just learned to take that and just let that roll off your back. But I remember asking
a goldfish, right?
one time, like, hey, like this says R, should we be using this since we're in a left knee? And seeing a bunch of eyes pop open and realize we were using the wrong sided instruments.
Right.
And then having to correct that, Thankfully, nothing had been done that was like irreversible, but if it had kept going, that could have been bad.
And all those things that we do, taking the time out, sitting back, making sure that the people that are in the room with you, making sure that everybody feels comfortable, right? All of those things ultimately will the good of the patient. They all make things better for that patient because we don't have, if somebody sees something that they're concerned about sterility, that they're concerned about patient safety, if they're concerned about, doing the right thing, and they feel comfortable and have enough courage, but also enough confidence that I can say this without being belittled or berated or whatever in the operating room, then that you've established an environment that's conducive to doing what's best for every patient. And that part, I think, is the key in the OR of recognizing that everybody in there can be part of the team.
Right. Yeah. I also have my notes on here about how no amount of preparation can prepare you entirely for the real deal, but it sure helps.
Yeah.
And so thinking about things like before you go on your first surgical rotation, like all this time I spent in like the cadaver lab, like looking at these, cadavers, people who voluntarily given their bodies to science so that we can learn from them. You spend all this time, you're identifying anatomy, you're in netters, like reading, like doing all this. And then you get in like, this guy had a gunshot wound to the right upper extremity, and it was near it involved the axillary artery. So the brachial plexus is right there. And I remember the attending going, okay, what am I looking at right here? And he was pointing at one of the branches. And I was like, I remember the thing I said was, this doesn't look like anything like what it looked like in the lab. He said,
in the book.
Right. And he looked at me and said, but did the mnemonic change? And I was like, what? He goes, did the mnemonic that you use to memorize,
Right.
the terminal branches of the brachial plexus change? And I was like, no. He's like, tell me the mnemonic. And so I did. And I don't know if we should say it on air because most of the mnemonics we learn are
Very
not the
true.
best.
Yes, that is true.
But he was like, what's the M mean? That's the first M. And I was like, musculocutaneous. He's like, yeah, there you go. He's like, that's the one. He's like, you got it. It doesn't look the same, but that preparation you did, and I can tell you did because you know enough, like you just have to remember, like it still helps you, just because it's not exactly the same.
Right. Absolutely.
Doesn't mean it's not worthwhile. So like all the times in the sim lab, all the times memorizing, those silly mnemonics and stuff so that, again, when you get overwhelmed or lost, that you can take that deep breath and go, what are things that I know? What do I know for sure?
Right.
I know I'm at, know where I'm at, right? I know this area. I know that I know he's blowing out his axillary artery because I've seen the CT angiogram.
we know
that. So, okay. Then reorienting myself.
Right.
In that situation, then your North Star is the blown out axillary artery. But
Right.
Still.
Right. No doubt.
Yeah.
That's very true.
all the practice and all the preparation time. I mean, that's why when you hear about some of these cases of like when you read about Dr. Death, like Christopher Dunch, where he didn't spend very many hours at all, like actually training and in an operating room compared to other people, who are neurosurgeons who are in his level of training where they should be. He was a small amount of time,
Right.
which is how, you can think of why a lot of things went as bad as they did with those cases. Right. Why people got hurt.
And you've got to do, if you're training, you've got to do volume, right? You've got to have experience. You've got to have exposure. You've got to be putting scopes in and out of shoulders, in and out of knees. You've got to be looking to see where things are and see how you can get oriented. And, when you see a bucket handle meniscus tear, a meniscal root tear, or an ACL tear, or a PCL tear, or a multiligamentous knee, like how are we going to do this and approach it from that stepwise process? But if you haven't had the time in the OR, then it just is a massive challenge.
Yeah. And you learn that from sports too, like with gymnastics. How many times did I try to do a standing back tuck before I finally landed it? Hundreds, before I finally got it, right? And then could replicate that.
How many times did you land on your head?
Never like directly on my head, but it would have been my neck quite a few times. Most of the time what happened is I would get the full revolution, but I'd land on my knees or I'd land on my butt, right? Like you would over or undershoot it. It was learning how to get high, how to get back, but not over or underdoing either one of those, right? And that's like every skill that I got in gymnastics after you get past the basics of that is, hundreds of times of attempting something before you actually can do it. And even when you get it that first time, that doesn't mean you'll get it every time afterwards. Yeah. I got my first standing back tuck and thought, yes, I'll be able to do this, for one, I really wanted to advance. And so I was hoping to compete that season, the next level up. But it took another like 2 practices, which those practices are 4 hours each. So 8 hours later before I could hit it again.
Yep, I believe it.
So
what was your favorite stunt in gymnastics?
Stunt. Ooh.
Is that not, is the standing back tuck not considered a stunt?
You could call it that. It just reminded me of my cheerleading days.
Cheerleading, so, I guess.
Yeah, when you said stunt, I went to when I was a cheerleader, and I was going to say scorpion for sure because I loved I was the only person in our cheerleading squad who could do a scorpion.
What is a scorpion?
It's where you're on one leg, so you're the flyer, and you take your back leg and touch the back of your head with it.
What?
Mm-hmm. So you go up onto a liberty, and then you grab your foot, bring it around, and touch. Mm-hmm.
That's crazy.
Yep.
My favorite stunt was a log roll.
I bet you were awesome at it.
I was really good at log rolling. You can just lay on your side and roll.
Yep.
Wait, you need me to roll the other way? Don't worry, I can do it.
That is literally the only time I ever went up into a stunt. I was always a base. So I was strong. And so I was normally the person putting the flyer up in the air, but that was the only stunt that nobody else could do it. So I had to. And that was lots of fun. For gymnastics, my favorite events were floor and beam. I was terrible at bars and didn't love vault all that much.
Pommel horses for men.
Correct. My 4-year-old son is really into that right now, trying to be.
And rings as men too, right?
Mm-hmm. Yep. The Iron Cross, if you ever see people do that, that's just crazy to see.
Yes.
Like favorite stunt that I was ever able to do, like to land.
Yeah. Cartwheel.
Yeah, I could do a cartwheel. I could do a one-armed cartwheel. I could do an aerial. I could do a round off.
An aerial is a no-armed cartwheel.
Mm-hmm. Yeah. Nice. I could do a cartwheel on a beam. I could do an aerial on a beam. I could do the aerial dismount off of a beam. I liked all those. I'm trying to think favorite. For me, I don't think I had a favorite thing. Anything that involved like flexibility, I was really naturally good at.
Sure.
And so, but that wasn't the things I tend to enjoy the most because I didn't have to work as hard for them. Yeah. It was the things that required a lot of strength, which again is like failing hundreds of times before you can get it. That's where there's something really gratifying about doing that. As a now 37-year-old woman, the fact that I can finally do sit-ups again after not being able to do those for 10 plus years, like it sounds silly, but that's like something that I'm proud of. Like without having somebody having to hold my feet down, I can actually engage my abdominal muscles. They exist and I can sit up. Who knew?
Nice. There you go. Look at you.
I know.
You'll be in the movie 300 before you know it.
King Leonidas, obviously. That's the only role that I could play.
For sure.
We used to call my roommate in college had those like Spartan sandals.
Yeah.
And she had a pair that laced all the way up to like the knee. And so whenever we would go out to Northgate, she wore those. We called them her King Leo shoes.
Nice.
You know, sweet little endearment you gave your college roommates.
So your gymnastics years influence you today how? Besides having your kids be in gymnastics.
Well, and again, if my kids told me they don't want to do gymnastics, they don't do gymnastics.
And you just tell them you got to do gymnastics.
No. I'm much more of a proponent of doing things that you enjoy doing. If you don't enjoy doing it, then at this stage of their lives, they don't have to keep doing it. I'll make them finish a season, right? Like, we're going to try this for a consistent period of time, and if you hate it, then we'll move along. But
Right.
they all still seem to like gymnastics as of right now. Man, it influences me in a lot of ways. I mean, just perseverance, like working really hard at something, feeling yourself fail over and over and over and over and over again, and then finally getting something, battling fear. That was a big one for me. I was a bit of a scaredy cat when I started. Like, I was afraid I was going to break my neck. The first time I tried to do a back walkover on a beam, I split my leg really good. That meant that when I went back, my leg that was planting missed the beam. And so I got a friction burn from the inside of my ankle all the way up, like my leg, and had essentially a nice burn there for several weeks. But things like that, you get scared of it, but then overcoming that and getting back up and doing it again.
You hear about that a lot, right? I mean, that's now that's a big trend, right? I've failed more times than you've tried, you know, right? If you want to be successful, you're going to have to you can't be afraid to fail. You can't be afraid to try, right? Because there's one surefire way to ensure that you don't ever succeed, and that's to never try.
Yeah, never to try or to stop.
Right.
Right, to stop when something gets hard. And again, if it's not something that you're passionate about and you don't care about, okay.
Even if you only have 52 subscribers.
Yeah.
Look at that.
Yeah.
52, like I said, 25% increase.
So
That's courtesy of Dr. Monroe and his very pale skin.
He said he'll come back on when you get 100, I think.
Yes, and but this time he's gonna wear a Master and Commander outfit.
Oh, that will be awesome.
Did you see it? Did you see his avatar?
I did see it. Believe it or not, I did watch that.
With your eyes open, you normally turn it on and sleep.
Shh, don't tell everybody my secret.
The sweet, sweet sounds of our voices puts Taylor immediately to sleep for a nap.
Yeah, but it gets you that listen.
It's good. It's good.
You get that
the aura ring telling you, are you listening to a podcast again?
Yeah. Mine just tells me, enjoy your nap.
Enjoy your nap.
Yeah.
It's good. Nap time excitement. It's all good.
My watch loves to like give me, props whenever I take a nice nap. So
what are you doing for Thanksgiving? Anything fun?
Hanging out with the fam.
Besides working?
I'm not working for Thanksgiving.
Thanksgiving Day, we have cases.
No, we don't.
You're not going to be here. I need you to get those. I need you to get those TPS reports in.
It's a nerve.
Come on.
Gonna go down to hang out with my family on the coast. Help my mom cook Thanksgiving food, and then also re-cooking everything for my kids who have the dietary restrictions. So it's always fun.
What's your favorite thing? What's your favorite thing you're looking forward to most to eating?
For eating?
Don't say something stupid.
Like what?
I don't know.
You like don't say kale.
Tofu. I can't wait to have a salad for Thanksgiving.
I'm a big fan of when we go for Thanksgiving is I get a little bit of everything on my plate. Like I'm one of those people with a big oval plate and I just have little like patches of different things. I don't like green bean casserole.
But I thought you didn't like your stuff to touch it. So no.
That's what I said. There's the little patches.
But there's space between all of them? Oh no.
I get like a little, so I get like an amuse-bouche, like a 1-2 bite of each thing. Then whatever is really good, then I go back and get a more substantial portion of. But my mom's rolls are always really good.
But you can't eat rolls because you hate rolls.
It's crazy. I don't even like rolls, but I will eat them on Thanksgiving.
Nice.
So again, my healthy rules are right now I'm in like a 90-10 phase, right? 90% of what I eat is really, really good and healthy for me, helps me meet my goals. 10% is for enjoyment. 10% is making sure that I'm still living life.
I'm flipped the other way.
Yeah. One day that'll change, right? When I'm not in a phase where I'm trying to actively lose more weight, then I'll go down to where it's a 80-20, 70-30, something like that. Just not there yet.
I'm with you.
But anywho, I'll use that first plate is just to trial everything to see what was really good this year. And some things, when I have that one bite, I'm like, that's all I needed of that.
That's all the cranberry sauce I need this year. Although Chrissy's cranberry sauce is really good.
Yeah. I saw this somebody sent me a reel the other day, and it was like they made remember when we came to y'all's house and y'all had the like sliders on the Hawaiian rolls? So it's essentially using your Thanksgiving stuff to make a version of that, like with your leftovers. And I was like, I'm going to take some Hawaiian rolls down to Mom's house and for after Thanksgiving, use that to make some leftover Sammys to take home.
Chrissy had like some spread that she put in there with the meat and cheese and something else, but then she also uses like a compound butter on the top.
Yeah,
so I don't know if you remember that, but she put stuff on top of the rolls.
This is a little bit healthier.
Boo.
This
Boo.
person, there's a. Okay, fine.
Boo.
So
again.
this person used it was the Laughing Cow cheese like wedges, and she made a like caramelized an onion, put that in, made a spread, put that on the bottom, and then put the ham and turkey, and then put cranberry sauce over top of it. Then the top, and then she just used olive oil and garlic as the top instead of like a compound butter.
So just to be clear, you're claiming that that's healthy?
Yeah, it was only 180 calories per sandwich.
Per one bite?
No, per sandwich, per the little Hawaiian roll.
I do love Hawaiian rolls. They're the best.
But she was using like the Laughing Cow, like reduced fat wedges,
It kind of makes me a little bit sad.
Yeah, they looked really good though. Yeah. And again, Thanksgiving I'm not going to try to go like crazy and I'm sorry, I'm just going to have a salad while you all eat this.
I think you might try.
No, I won't.
I'll just have a glass of water and a crouton, please.
No, but I will have a big glass of water that morning, and I'll eat a healthy morning meal, and then I'll make sure I balance the rest of the week like I should.
Me too. No.
All about balance.
I've got football, lots of football. That's going to be, so not only Thanksgiving Day football, but College Park High School plays football, potentially either on Friday or Saturday. If they win this Friday, don't need to put the cart before the horse, but they will either play on Friday or Saturday. I'm supposed to go back to Austin on Friday also, and my family has concocted some sort of a plan where they would like to try to last minute purchase tickets to go to the Texas A&M Texas game, but wait until the very last minute and then buy the tickets when they're apparently cheaper. I don't know.
Good luck.
Yeah, that's what I said. I don't think that's going to happen.
Somebody the other
number
day.
3, the Longhorns with the opportunity to ruin Texas A&M season.
Yeah. One of the guys I work out with at unnamed gym was selling
They can
his
sponsor us too. F46.
was selling his A&M UT tickets.
Really?
Mm-hmm. You may or may not know this person.
Are they a patient or something? You can't say their name? No, we cannot say their name.
Mm-hmm.
Because, interesting. Is it Mac Brown?
Mac Brown. Yes, Mac Brown selling his tickets.
Sweet. Hey, Mac, we need some tickets. No, I kind of want to just watch the game on the TV, but it would be fun to go. I think Austin is there's so many people in Austin who have there'll be a lot of Aggies at that game. So I think it's going to be a fun game. I think it is going to be a very close game, and I think it's also there's going to be a probability. I bet you that A&M is not more than a 3-point favorite, if not even potentially being an underdog, even as an undefeated number 3 team in the country. They will have no respect going into Austin. Yeah. So I'm sure I could look it up now, but I haven't looked to see what it is.
Fact check yourself later.
Yeah. Check the facts. Yeah. I think it's going to be a good game. I obviously think A&M is going to win, but have an undefeated season, go to the SEC championship, and then beat Georgia. Maybe. To all my Georgia Bulldog fans.
Lady Spine Doc.
Sorry. Lady Spine Doc. Does she follow us?
We should see.
We'll look it up. She has 100,000 followers. We have 50. We have 50. She has 1 billion.
Yeah.
She is pretty cool though. She's a cool lady, at least from what I can see.
Oh yeah.
I think she's going to be. She's doing good stuff for people, influencing people in a positive way, which is, I think, great.
Using her platform for good.
Right, which is awesome. Right. I mean, I think that's the whole point, right? If you can help lift people up and make people better, then what more can you ask for?
I like her because she most of the time employs somewhere in the neighborhood of 3 to 4 PAs. So she's really keeping our profession afloat.
She's a big PA advocate. But do you think she doesn't force her PAs to be on her podcast?
They are on our social media stuff, though.
Yes, they are.
So I don't know how willing that is. You can blink twice on your next video if you need me to help.
If you need Taylor to help you. Taylor, this is how Taylor does all of our videos.
Please,
someone help me.
Yep.
I'm blinking.
Yeah, I just updated my LinkedIn.
Oh, LinkedIn. I got on it yesterday.
Oh, no.
Yes. Yeah. Oh, no. I'm pumped about it. I was like, this is like second Facebook. It's so
You're
good.
so old.
Old? I thought that LinkedIn was just like what was the other one? Monster.com or something, like where you apply for a job. That's what I thought LinkedIn was. Like, do you have a LinkedIn account? I was like, I'm good. I've got a job. I'm
like
fine.
Indeed.
I'm fine. Like, are you asking me? Like, are you offering me a job or what are you asking me? Do you have LinkedIn? And I was like, I don't know. I didn't know what it was. So I was like, no, but it's all good. But now I have it. And there's all kinds of people. I'm making connections left and right again. It's so good.
Sparking joy for you, I can.
But I sent you a request. Nothing.
Because I'm not
from Taylor.
Well, like I told you, if you see my
0.
LinkedIn's updated, it's because I am looking for a job. So you should be nervous.
Taylor, so bad. It's like,
I think the last time I updated it's when I was looking for the job in South Dakota. I'm pretty sure.
Boo. That was when you were going before me, though. The South Dakota job. Well,
yep, BJP. Before JP.
What?
Before I worked for you.
Yeah.
It's like BC, but it was BJP.
There you go. Mm-hmm. You got to pronounce all those letters together.
I tried to.
Yeah. No, all good. All good. Yeah. What else? What else do we need to talk about? We got A&M. We got Thanksgiving. We got Christmas around the corner. We've got New Year's coming. We have
spam risk.
Taylor takes phone calls on the podcast. Don't worry. Who's calling us?
It's 713. Should we answer the spam call?
Should answer. Hello. What are you telling me, John? I was approved for a $60,000 loan? No way. This is so good.
No, and I know it's not just me because when I was in PACU the other day, one of the surgeons picked up his phone and said hello because it was clearly a Houston number 2. He's like, no, I'm not trying to sell my property. Bye. And that's the exact calls I keep getting is are you willing to sell your property in blank? I'm like, no, because it's not listed as for sale.
Right.
Like, please stop
awesome.
calling me.
That is awesome. Have you hit your 100 workouts yet? Are you getting close? You've got to be getting close.
I'm getting close. I can tell you.
Do I need to go do it? Does my workout need to be you guys' 100th workout?
No, we need to do yours when
they have a big trash can for me to throw up in.
No, I mean they'll have it. I'm at 91.
So you're 9 away. We could just schedule it. When's 9 from now?
Be 3 weeks from now.
Thanksgiving Day.
3 weeks. So.
That's perfect timing.
2 to 3 weeks.
That gives me plenty of time to get it into my LinkedIn schedule.
Yeah, we need to pick a time and date so that way we can make sure that the people who all want to come witness.
So that all of the gawkers can show up.
They're going to be working out too. They're not going to heckle. They're going to be working out.
There's going to be some heckling. I have a feeling there's going to be some heckling.
You think Dan's going to heckle you?
I bet Dan heckles me for sure.
No, I told you already. He said if you throw up, he will respect you even more. Because you tried so hard.
But when your level of respect is here, a little more is not.
Hey, that's not true. That's not true.
If he throws up, then I will respect him.
No, he said he will respect you even more.
I know.
That's different.
I am just messing
I
with
will
you.
judge you quite a bit.
If I throw up.
Yeah.
And positively or negatively?
Guess we'll find out.
I'm not throwing up.
Just try really hard.
Is there a chance I'm going to rupture my Achilles? Possibly.
Again, there's modifications for everything. And you, as a board certified orthopedic surgeon, could probably figure those out pretty easily.
And if most of the modifications include laying down on your side on a bench in a fetal position, then yes.
And instead of doing this box jump, what we're going to do here is you're just going to lay.
Instead of doing this box jump, I'm going to just sit on this stool that Taylor's lowered all the way down to the floor. Because I do this in the office every day.
I'm so prepared for this.
I have been waiting for this all my life.
How mad would you be if the thing that like pops your Achilles is like the easy exercise station where we're just doing calf raises? Yeah.
I was just doing some calf raises.
And here I am.
All I did was sit down to examine a patient.
Yeah. I think what we should do for your first class, because it's not going to be your only. It's just your first. You're gonna get
recruiting
hooked.
me. You're recruiting me. Yeah, I believe
You
it.
probably won't come to the one that I come to. You'll go to one that's more convenient to you. But there's one in Creekside. Like there's all kinds. They're everywhere.
Yeah.
So we'll find you a home.
I have a feeling Chrissy's big into Pilates. She loves it.
So you think you're gonna put some leg warmers on and go hit up some Pilates?
I'm not doing Pilates. I don't even understand it.
Well,
It's like a torture chamber. It
you
looks
and her
like.
could go together and do F45. Y'all would love it.
Well, I mean, we do love to do things. She does love to see me vomit.
That's what I mean. She'll get immense enjoyment. Every time she's struggling, she just looks over at you and sees how hard you're working and just goes, yeah.
This is great. That guy
Gets a burst of energy.
He's doing fabulous.
He's doing awesome.
Yeah. Well, that's what I need. I need that positive reinforcement while I'm there. Less of the laughter.
Yeah.
The laughter is going to be the challenge for me.
I'm not going to laugh at you. I'm going to be so busy focusing on my own workout, I'm probably not even going to pay attention to you.
This is going to be like the TikTok video where they do the chicken dance and everybody's lined up, except in the end it's just me doing the dance in the front and everyone else is laughing at me.
No, that's not going to happen.
I'm not concerned about that because I don't mind making people laugh, nor do I mind having fun.
Nor do you mind throwing up.
I don't particularly like throwing up. Just to be very clear, throwing up not really my thing.
Mm-hmm. Yeah, make sure you wear the required
plastic
unitard.
shirt.
Yeah, make sure you wear that.
I got to wear Spanx.
Mm-hmm. Nice. Full body Spanx though, like turtleneck,
all the way to the ankles.
Include the feet.
Okay.
With the non-slips on the bottom.
Nice.
For protection.
So I'm wearing a bodysuit to this.
Yeah.
What color? Tan?
Yeah, flesh colored would be best. Just get kicked out right away.
I'm here for F45, everyone. This is my tan bodysuit that Taylor is making me wear.
Mm-hmm.
It's going to be good. It's going to be good. Well, I'm looking forward to it. I'll do it on your 100th. Just schedule it.
I think
I'm going to steal your glory from 100.
Taylor's 100th workout and you're first. They make you take a picture when it's your 100th workout. So,
what about if it's your first workout?
No, they don't make you take a picture because you look like dead.
You look dead. Wait a second. You said I was going to be fine.
We're going to do your first one. We'll make it a good resistance workout. So it'll be more like weightlifting and stuff and less like running and jumping and jogging and stuff.
All right. I'm down. Mm-hmm. I am down. Well, I think that's going to be it for us for today. What do you think?
Sounds
Anything
good.
else?
Sounds good to me. I'm here on your dime. Your time.
Thanks so much, friend.
I do this out of the goodness of my heart and because you paid me to.
Because you pay my paycheck.
Absolutely.
Well, that's true.
Could be seeing patients right now, but instead I'm sitting here talking to you.
Well, I did. I talked with 3 doctors today, plus a 4th and a 5th, 6th. So probably we're just going to have a lineup of doctors waiting to get on here. Mm-hmm. Dr. Monroe is dedicated though. Mm-hmm. Hopefully he's still watching, but maybe by the time this one airs, we'll have like 1,000 followers because he is pushing hard to try to get us followers.
Well, he really needs to work on getting that suit then.
He needs to really work on getting a tan.
That's not nice to say.
He just looked awfully pale. He was nervous. And the lighting was maybe a little bit off. The lighting and the lighting later looked great, but he just sort of started getting way washed out. And then that's the picture that I screenshotted and sent to him. Mm-hmm. It's like, here you go.
Enjoy this.
Enjoy this.
Casper.
All good. All right. You ready? What is this?
Jazz hands.
Is that the thing? Taylor is not dancing. I wonder if everyone who has this plays the same music, or if no one plays this music at all, and we're the only ones.
Hard to know.
Well, they're a bunch of losers.